The Electronic Acute Resuscitation Plan, eARP, and Pediatric Acute Resuscitation Plan, PARP, will be made available in the eAMR in December 2020. This enhancement improves visibility of patient resuscitation planning in the electronic record and supports continuity of care for patients at risk of acute deterioration. This video demonstration will show how to identify eARP, PARP status in the banner bar and review the details of the eARP management plan. Throughout this video, eARP and PARP will be used interchangeably. The Electronic Acute Resuscitation Plan eARP Power Form has built-in decision support, auto-transcription of patient information, and updates to other nursing medico-legal documentation, for example, admission power forms. The custom eARP M-page within the eAMR is available for review across all positions, including view only. The eARP M-page is where doctors and nurse practitioners can review, create, and modify the eARP. Please note, the eARP and Pediatric PARP Power Form is completed by senior medical staff or junior doctors and nurse practitioners with consultation. The eAMR patient banner bar alert will be added or updated to display the eARP status when an eARP is created or modified. When an eARP is created, an alert is added into the patient's alerts and problems. Active eARP. The patient has a valid or active electronic eARP documented. A patient can only have one active eARP at any time. Inactive eARP. The patient has an electronic eARP that has expired or has been voided. No eARP. The patient has never had an electronic eARP documented against any encounter. Please note, a paper eARP may be in existence. eARP undefined needs review. Clinical review of the eARP is required following patient record maintenance by HIMSS. Or, a PARP is invalid for a patient turning 18 years of age and requires clinical review. Please note, if the patient is deceased, then the eARP status will be replaced with the deceased indicator. We've launched the eAMR and opened the patient's chart. We will review the eARP status in the banner bar. For this patient, they have an active eARP. We use the menu to navigate to the Acute Resus Plan eARP page, where we can review the details of the eARP under the Resuscitation Management Plan heading. In this instance for our patient, we do not provide CPR. If an acute deterioration or critical event occurs, it is clinically indicated to provide IV fluids and pain relief. We are not to provide defibrillation, intubation, or CPR. You can review the history of modifications to the eARP under the Acute Resuscitation Plan Pediatric eARP heading. In this instance, you can see that we have an active acute resuscitation plan and multiple superseded acute resuscitation plans. To view the eARP form, click on the Acute Resuscitation Plan hyperlink. A textual rendition of the clinical document appears for review. To access the Advanced Care Planning page from this screen, you can click the ACP Tracker hyperlink or use the menu to navigate to that screen. This video demonstration has shown how to identify eARP status in the banner bar and review the details of the eARP management plan.